Hey guys, if you're reading this email and you're wondering what can you do if you're not drinking fluoridated water and you're not using fluoridated paste, what can you do to ensure that you do not get tooth decay? Let me just ease your mind by saying fluoride is such a small factor when it comes to the prevention of tooth decay. You do not need fluoride to prevent tooth decay. You don't need it, and you shouldn't be drinking it, and you shouldn't be using it, because we know now, studies have come out. They've been there for a while, but it's just gaining more attention now in the public media, that fluoride has its health risks, okay? So it's not without some adverse health consequences if you consume a certain amount of fluoride. And so what can you do without fluoride to prevent tooth decay? Well, first of all, so many things, but I'm always going to go back to diet. Okay, because tooth decay, it's all about balancing your oral microbiome. You won't get a cavity if you have a balanced oral microbiome. And in order to do that, you have to feed the good bugs and starve the bad bugs, okay? And you do that by diet. And so if you're eating a diet that's rich in vegetables, fiber, vitamin K2, and I'm not gonna give a list of all, those foods. You can look that up on your own. Google foods rich in vitamin K2. Google foods that promote a healthy oral microbiome. But please keep in mind that disease occurs in the mouth because of a dysbiosis. And dysbiosis is just a fancy word of saying there's an improper balance between the good bacteria and the bad bacteria. Your mouth is full of bacteria. We'll never get your mouth sterile. We don't use mouthwash because mouthwash is so harmful on the oral microbiome. It kills all of the beneficial bacteria. And it actually, if you're using conventional mouthwash, you're actually doing more harm than good to your oral microbiome. So I know you've heard me say it before. Please throw your conventional mouthwash away. And start doing some research on what are good oral probiotics for your mouth. What is the bacteria, the beneficial bacteria that we want in your mouth in high amounts? Start taking oral probiotic supplements. This should be a daily staple. So ditch the fluoridated paste and pick up an oral probiotic. There are so many good ones out there now. And if you don't know which strain of oral probiotics to take based on your unique oral microbiome, do a salivary test. I offer saliva tests so that we can really dial in on your individual bacteria levels. What bugs or bacteria are you high in? Which ones are you lacking? Where are you imbalanced? And so that gives us a good starting guide to figure out what we can do to get your oral microbiome more balanced, because if your bacteria are in symbiosis, you're not going to get tooth decay. You don't need fluoride, okay? So we really have to kind of change. We have to think of this in just a new paradigm. The dental community needs a paradigm shift, and I know a lot of my patients already know this. And I love the fact that you guys have such a high dental IQ and we can have these conversations in my chair. I always enjoy them. But I just want to reassure for those that are kind of feeling mom guilt, or you're not sure, am I doing the right thing for my family? Keep on going, because fluoride does not need to be in the equation. So hope this helps, and I'll see you guys next time.